Edward Thorndike is one of the greatest learning theorists of all time. He believes that instruction should pursue specified, socially useful goals. In his 1928 classic study, Adult Learning, he postulated that the ability to learn did not decline until age 35. He did not believe that you can't teach an old dog new tricks. Later, it was proven that indeed the power to learn did not decline with age, but it was the speed of learning that did. Thorndike supported Dewey's functionalism and added a stimulus response component and renamed it connectionist. His theory became an educational requirement for the next 50 years. And I will be discussing Thorndike's three laws of learning and his five characteristics of learning. Our learning objectives for today are as follows. Thorndike's stimulus response framework states that learning is the result of associations forming between stimuli and responses. For example, when a mosquito lands on your skin and bites, it produces a stimuli. One's response would be to slap it with a hand because you've learned from past experiences that bite will cause itchiness and urticaria. Such associations or habits become strengthened or weakened by the nature and frequency of the SR pairings. The paradigm of SR theory was trial and error learning, in which certain responses come to dominate others due to reform. The hallmark of connectionism, like all behavioral theories, is that learning could adequately be explained without referring to any unobservable internal. Thorndike specified three conditions that maximized learning, which we also refer to as the three primary laws: the law of readiness, law of exercise, and law of effect. Let us discuss each one in more detail. The law of readiness was intended to account for the motivational aspects of learning and was tightly coupled to the language of science of neurology. It was defined in terms of the conduction unit, the term Thorndike used to refer to neurons, synapses, or parts of those synapses, or whatever makes up the path which is ready for conduction. In its most concise form, the law of readiness was stated as follows. For a conduction unit ready to conduct, to do so is satisfying, and for it not to do so is annoying. The law of readiness is illustrated in this example. Like when a child sees an attractive object at a distance, his neurons may be said to prophetically prepare for the whole series of fixating it with the eyes, running toward it, seeing it within reach, grasping, feeling it in his hands, and curiously manipulating it. A good example of this in medical school is a situation wherein a medical student trained to apply cardiopulmonary resuscitation sees a drowned victim or a person who suddenly lost consciousness. His conduction unit is instantly set into motion such that he automatically runs to the patient, assesses the situation, and applies CPR. The second law is the law of exercise, and it has two parts: the law of use and the law of disuse. This law stated that connections grow stronger when used and grow weaker when not used. Strength was defined as vigor and duration as well as the frequency of its making. Thorndike later made a qualifier saying that repetition must be guided by feedback. For example, he said, a blindfolded person cannot perfectly draw a 4-inch straight line by simply repeating it 3,000 times. Uh, for him to be able to draw a 4-inch line while blindfolded is for someone to give him feedback while he is doing it. Someone should be saying that the line is too short or that the line is too long that he's drawing. In the same manner, if we can apply this law to medicine. For example, during ophthalmology training, the residents are taught all types of surgeries, one of which is cataract extraction. If the patient is industrious enough in seeing patients in the OPD, recruiting them and scheduling them for cataract surgery, then he will have a lot of practice. And by the time that his training finishes, his incisions will be straighter, they will be even in depth, his movements and transitions smooth, and the procedure will take less time to finish. This improvement or learning in skill results not only to happy patients, but also to a happy doctor, which leads us to the third law, the law of effect. The law of effect added to the law of exercise the notion that connections are strengthened only when the making of the connection results in a satisfying state of affairs, and that they are weakened when the result is an annoying state of affairs. The classic example of Thorndike's SR theory was a cat learning to escape from a puzzle box by pressing a lever inside the box. After much trial and error behavior, with Thorndike returning the cat inside the box again and again, the cat learns to associate pressing the lever with opening the door. This SR connection is established because it results in a satisfying state of affairs, which is escaping from the box. The law of exercise specifies that the connection was established because the SR pairing occurred many times and was rewarded, as well as forming a single sequence. Thorndike later modified this through a variety of experiments. He said that satisfiers or rewards and annoyers or punishment are not equal in their power or to strengthen or weaken a connection, respectively. In one of these experiments, students learned the Spanish vocabulary by selecting for each Spanish word one of 5 possible English meanings, followed by the rewarding feedback of being told right or the punishing feedback of being told wrong. From the words of Thorndike, the announcement of wrong in our experiments does not weaken the connection at all. So, rather, there is more gain in strength from the occurrence of the response than there is weakening by the attachment of wrong to it. Whereas 2 occurrences of a right response followed by right strengthen the connection much more than a single occurrence does, 2 occurrences of a wrong response followed by wrong weaken that connection less than 1 occurrence does. In medical school, clerks and interns learn to be more emphatic and spend more time and patience in explaining diseases to their patients when they receive small gifts from their patients on follow-up. Those who do not get as much gifts from their follow-up patients, which is punishment, try harder to get similar rewards from their by improving their performance in succeeding encounters with patients. Thorndike's 3 laws were supplemented by 5 characteristics of learning, but these are secondary in scope and importance only to the laws of readiness, exercise, and effect. Let us discuss them one by one. Multiple response or varied reaction means a change or variation in response until an appropriate behavior is arrived at. For example, when faced with a problem, an animal will try one response after another until it finds success. In surgery, we believe in the saying that there is more than one way to skin a cat. The end goal is to remove a tumor or cataract, and this can be approached by using various methods. Number two, set or attitude. This means learning is affected more in the individual if his is to learn more or to excel at the time. For example, a medical intern who is set to go into a surgical residency program after graduation will certainly seek to perform well and learn much more during his surgical rotation. His performance in a pediatric rotation might not be as much, since his main goal would just be to pass that pediatric rotation. Thorndike's classic example is the chick, or the small chicken. Depending on his age, the chick's hunger, vitality, sleepiness, and the like, a chick may have varied response when presented with danger situation. A sleepier and less hungry chick will, as a rule, be set less toward escape movements when confined in a box. Its neurons, which are involved in roaming, perceiving companions, and feeding, will be less ready to act. It will not, in particular, try so hard to get out or care so much about being out. Number three, partial activity or prepotency of elements. This means the learner would react selectively to important or essential in the situation, which is prepotency, neglecting the non-essential features, thus leading to analytical and insightful learning. An example of this in medicine would be learning to ignore non-essential signs and symptoms not directly related to the most critical or urgent problem of our patient. For example, when treating a patient with pneumonia, in a patient who is also complaining of occasional joint pain, a doctor would first concentrate on treating the pneumonia, looking for the proper antibiotics to give him, rather than thinking of what painkiller to give for the non-urgent joint pains. In the example of a cat, Thorndike said that a cat that has learned to get out of a dozen boxes, in each case by pulling some loop, turning some bar, depressing a platform, or the like, when placed in a new box, will be more attentive to small objects on the sides of the box than it was before. Number four, assimilation. Due to the assimilation of analogous elements between two stimuli, an animal will respond to a novel stimulus in the way that it has previously responded to a similar stimulus. Simply put, this means utilizing old experiences in new situations. In Thorndike's words, to any situation which have no special, original, or acquired response of their own, the response made will be that which by original or acquired nature is connected with some situation which they may resemble. Lastly, number five, associative shifting. This refers to the transfer of a response evoked by a given stimulus to an entirely different stimulus. In other words, we may get a response from the learner by utilizing other situations to which he is sensitive. Thorndike's example for this is the ordinary animal tricks in response to verbal signals and motions. One, for example, holds up before a cat a bit of fish, saying, "Stand up." The cat, if hungry enough, will stand up in response to the fish. The response, however, contracts bonds also with the total situation, and hence to the human being in that particular position, giving that particular signal as well as to the fish. After enough trials, by proper arrangement, the fish can be omitted, the other elements of the situation serving to evoke the response. Association may later be further shifted to the oral signal alone. Now, connectionism was meant to be a general theory of learning for animals and humans. Thorndike was especially interested in the application of his theory to education, including mathematics, spelling and reading, measurement of intelligence, and adult learning. But his theories are without criticisms. The behaviorists deny the law of effect and claim that frequency is the most important principle of learning, which helps in all kinds of retention. While the Gestaltian school criticizes Thorndike on the ground that learning is not merely the organization of independent units of behavior. The relation between situation and response already exists in an experience which is perceived as a whole. Another criticism is that Thorndike's approach restricted psychology by limiting behavior solely to the peripheral events of stimulus and response elements. This makes the theory fundamentally physiological in nature. In so doing, it dismisses the importance of mental events. Thorndike ignored the central mediation of stimulus and response bonds. An example of this in medical school is when we treat diseases. When a doctor sees a patient with bipedal edema, which is a stimulus, his automatic response is not to simply give a diuretic. There should be a mental event first for him to decide whether the bipedal edema is due to a kidney problem or a heart problem. That is only when he can give a management, because the management are different for the two. Another criticism concerns the issue of reductionism. In fact, for Thorndike, mind was reduced to behavior, and behavior in turn was reduced to environmental stimuli and observable responses. There are no feelings or affect involved to deal with in learning. This is far from what we experience in medical school. For instance, a medical student would never forget learnings the, from the stimulus and response from a case where a patient died or lost an eye, for he would never want to have a repeat of such a case in his future career. The stimulus response framework, which states that learning is the result of associations forming between stimuli and responses, is certainly applicable to some learning situations in medical school. However, it is also safe to conclude that not all learning can be gained from this framework alone. There are instances where you don't need rewards or punishments in order to learn from an experience, a lesson, or a patient's case. Sometimes, pure motivation and curiosity is enough for the student to discover new ideas and learning. And sometimes, single episode, accidental, high impact experiences will impart more memorable and valuable learning for the medical student compared to what a forgettable repeating event is trying to teach. Thank you. This is the end of my report. I'd like to thank you for listening. And these are sources. I shall provide you with a printed script of this report. Thank you very much for listening again.